I want to bring in epidemiologist and ABC News contributor Dr. John Brownstein for more on this. Dr. Brownstein, the White House physician said that the president is, quote, unsurprisingly still testing positive for COVID. White House chief medical advisor Dr. Fauci also experienced a rebound case after taking Paxlovid. So how common is this?
Well, Diane, the best evidence we have is that these rebounds are still happening in a minority of cases. You know, there was initial clinical data that suggested it was at about 1%. I think it's likely much higher, whether it's 10% or 20%. I think that's still under study. But generally what we're seeing is that these rebounds are mild or even asymptomatic. So the president may not even have any symptoms, but we still have to learn more about these rebounds. It's possible that over time we may learn that a longer course of treatment may be needed. But, you know, we're applying a therapeutic in the middle of a pandemic. We're learning in real time. But what we do know is this drug is reducing the risk of severe illness. We've had over 3 million people take this drug and seeing no increased risk of hospitalization or death. So even if a rebound happens, it's not a reason to avoid this treatment.
Now, does this only happen after taking Paxlovid, or can other COVID patients experience rebound cases too?
Well, in clinical trials, they actually did see rebounds among people who didn't take Paxlovid, but it's still a small percent, 1 to 2%. What we're seeing here with Paxlovid is that this drug is reducing the amount of viral load immediately, but when you stop taking the drug, there's that chance of a resurgence of the virus. That's why it's specifically happening more in these patients.
And when you say that, for example, the president could be asymptomatic, is it possible that they're also then not contagious at that point? Is that being looked into?
This is such a good question, and it's actually something we don't know and something we need to learn. It's not clear if the rebound means you're contagious. He's testing positive, so there's a very strong likelihood, and this is why CDC recommends isolation for an additional 5 days, just out of caution, because testing positive could indicate that you're spreading it. But, of course, the president is under much closer watch than most people. Most people aren't necessarily testing for days after they've taken this drug, if they're not having symptoms. So a lot more we need to learn about how this drug works in the real world.
And I want to shift gears for a second, because the New York City Health Department has just become the second city now to declare monkeypox a public health emergency after San Francisco did the same. So what's the latest on that outbreak, and what do we need to know?
Well, we're seeing cases grow. We're over 5,000 cases in the U.S. We're seeing some exponential growth, but that could also be because of case backlogs and reporting delays. We're starting to see some deaths in other countries, though we haven't seen that in the U.S. But remember, contracting monkeypox is still considered to be relatively low risk. There is, of course, risk between skin-to-skin contact, potentially through aerosol, but we still are learning a lot about this virus in real time. Anyone is in risk, but we're seeing, of course, increased spread among men who have sex with men. So we have to target education, interventions, testing to those groups specifically right now. But there's still work to be done at the public health level. And this is why having these declarations of emergency are important, because it unlocks resources. And I think likely we'll see that happen at the federal level, because we need to up our response to this virus.
All right, Dr. John Brownstein, always great to have you. Thank you.
Thanks, Dan.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.